Hi, I'm Dr. John Leonard from Weill Cornell Medical College and New York Presbyterian Hospital. I'd like to welcome you today to our lymphoma program's presentation of our REDLAMP project, Review of Emerging Data for Lymphoma Patients, where we try to put together some information that may be interesting, relevant, and new to patients dealing with lymphoma. So today I'd like to discuss with you a recent publication from the British Journal of Haematology. This is entitled Disease Characteristics, Treatment Patterns, Prognosis, Outcomes, and Lymphoma-Related Mortality in Elderly Follicular Lymphoma in the United States. The authors of this include Shadi Nabin and Christopher Flowers. And so the premise behind this study is really to get a better sense of how do patients who are elderly how do they do with follicular lymphoma? And this is a product of the National Lymphocare Study. National Lymphocare Study is a study that went on, a registry study, where data were collected over several years, in this case from roughly 2004 to 2007 primarily, these patients with follicular lymphoma. And these patients' data were gathered to learn about how they were treated, their risk factors, and their outcomes. And so the authors in this study looked at overall about 2,600 patients with follicular lymphoma, but they focused in on the 200 patients or so that were over the age of 80. So the question is, if you're a follicular lymphoma patient over the age of 80, which is not a small population, it's a minority of the population, but still an important population, how do those patients do? Should they be treated differently? Should they have other expectations that are different out of the disease? And sometimes when we deal with older patients, we're worried about the toxicities of therapy. We're not sure what to expect out of the disease. And so there are several points to take out of this paper that I think are potentially useful for patients who are over the age of 80 dealing with follicular lymphoma. So the first is that, interestingly, but perhaps not surprisingly, most of these patients in the registry were treated less aggressively. So they were less likely to get chemotherapy, they were less likely to get more intensive chemotherapy. I guess that's not particularly surprising, since one might argue that older patients might want to avoid chemotherapy, maybe they couldn't tolerate it as much. And so that tends to be how these patients were treated, at least in this series. Whether or not that's the best thing for these patients or not, I think is an important question to consider. Another important point is that over the 5-year period, and again remembering that these patients were all over 80, that the majority of patients were still alive over a 5-year period. So that provides some, I think, reassuring news to these patients. And in the minority of those patients that died during that period, and again, you might expect that some, and in fact many 80-year-olds will have other medical issues over their lifetime beyond lymphoma, that the majority of these patients did not die from lymphoma. Those that died often died of other things. And so this is, I think, important information that gives us a sense of what to expect out of lymphoma in patients over the age of 80 with follicular lymphoma. And I think this highlights the need that we need to be especially thoughtful, especially careful as we approach patients over the age of 80. We may be more likely to reduce their therapy. We need to be cautious about what we expect out of the disease, the side effects of the treatment. And I think most importantly from this, I think we need to continue to study this patient population to figure out what are the best treatments that we can give these patients, perhaps as part of clinical trials, and older patients can be part of clinical trials, in order to define really what is going to give this particularly older, over the age of 80 patient population the best possible results to their therapy, and obviously improve their outcomes, including their quality of life. So I hope this information was helpful to you today. Thank you very much for joining me.